Hello everyone. In this video, we're going to talk about something many people do without even thinking, taking antibiotics for every fever. It's a common belief that if you have a fever, you need antibiotics to get better. But is that really true? And what actually happens inside your body when you keep using antibiotics again and again, even when they're not needed? Let's take a closer look at what happens when antibiotics are misused and why it's more serious than it might seem. Antibiotics are powerful medicines designed to kill or stop the growth of bacteria. They are extremely useful in treating bacterial infections like pneumonia, strep throat, and urinary tract infections. But the key word here is bacterial. Not all fevers are caused by bacteria. In fact, most common fevers, especially in children and healthy adults, are caused by viruses. This includes things like the flu, common cold, or viral infections that simply run their course and get better with rest, fluids, and time. When you take antibiotics for a fever that's caused by a virus, they don't work. They have no effect on viruses, but they still affect your body. Antibiotics don't only kill harmful bacteria, they also disturb the balance of good bacteria that live inside your body, especially in your gut. These good bacteria are part of your immune system, help with digestion, and protect you from harmful invaders. When you use antibiotics unnecessarily, these helpful bacteria get wiped out, which can lead to side effects like stomach upset, diarrhea, and even more infections. Another serious issue is antibiotic resistance. This happens when bacteria change and become stronger than the antibiotics we use to treat them. Every time antibiotics are used unnecessarily, bacteria get a chance to learn how to survive. Over time, this leads to the growth of superbugs, bacteria that no longer respond to regular antibiotics. This means common infections that were once easy to treat can become dangerous and even life-threatening. And it doesn't just affect you. These resistant bacteria can spread to other people too. When antibiotics stop working, doctors are forced to use stronger medicines with more side effects. And sometimes even those don't work. Simple surgeries or minor infections can become serious health risks. This is why the overuse of antibiotics has become a global health concern. It's also important to know that taking antibiotics when you don't need them can weaken your immune system in the long run. If your body learns to rely on medicine every time there's a minor fever, it doesn't get a chance to fight off infections on its own. Your immune system becomes less responsive, and you might find yourself getting sick more often. So, what should you do when you have a fever? The first step is not to panic. Fever is a natural response from a body. It's a sign that your immune system is working to fight off an infection. Most mild fevers can be managed with rest, hydration, and over-the-counter fever reducers like paracetamol. If the fever lasts for more than a few days, gets very high, or comes with other serious symptoms like difficulty breathing, rash, or confusion, that's when it's time to see a doctor. They can determine whether the cause is bacterial and if antibiotics are truly needed. The key is to use antibiotics only when they're prescribed by a medical professional, and only when it's clear that a bacterial infection is present. Taking them for every fever or sore throat may seem like a quick fix, but over time it could do more harm than good. Thank you for watching. See you in the next video.